From the KBIA newsroom in Columbia, I'm Rebecca Smith. Every single school in the state of Missouri is currently shut down as a way to prevent the spread of COVID-19. But for some parents, those with kids with disabilities, this presents even more challenges. I spoke with Christina Ingolia last Thursday on the phone. She's the founder and an active member of Missouri Disability Empowerment, a disability advocate group. She's also, more importantly, the mother of Lily, a 5-year-old who has cognitive disabilities from a rare genetic syndrome. We spoke about how she and her family are coping. So, Christina, you've been home for about a week now. How are things going with Lily?
Yeah, so I would say in general, things are okay with Lily. She's in a great mood and she health wise is quite stable, but because she has medical conditions that are complex too, we are taking a lot of precautions. And I think because she's getting a lot more mommy daddy time, things are okay so far. I mean, I think it will get old eventually, but for now, everything's going well, but I will say that it's a little scary because the services Lily gets through school and then like our private services. So I'm specifically speaking about like speech therapy, physical therapy, occupational therapy. She's really cut off from a lot of that. But today we found out my husband works for the state and they have a really good insurance plan that they'll cover occupational therapy through like telehealth. So we'll probably do some kind of FaceTime situation and we're going to try it out and hopefully it will work for Lily. So I feel really lucky. And I also feel really sad for most people who do not have access to that because therapy gives me a sense of what to do with Lily. It makes Lily happy. And then we can also measure her progress and push her along to do more.
Now, you're obviously very involved in the disability community here in mid-Missouri. What have you been hearing from other parents?
In connecting with friends through social media and other places, I think just a lot of people are scared and it's a lot of parents are feeling isolated. It feels like, you're taking care of your kid full time and you're working full time. And I do think that parents of typical children are, of course, facing challenges, working from home and child rearing at the same time, too. But I think we have this like added layer. And I think that's what we're all talking about of like the guilt, the need to constantly be doing activities, the feeling that your kid might be missing a major milestone if you're not pushing them enough. And, you don't want to see regression, like where your child kind of falls behind where they were at. It's really challenging.
So I'm wondering, while all of this is happening, all the kids are at home, how are you and other parents trying to promote and preserve your own mental health?
Yeah, that's a great question. I'm fortunate that I have a partner that's very active, my husband, and so we're trying to give each other breaks because the reality is we can't be doing therapy all day every day and we're not going to be a school environment. It's just not going to happen at home. But we can do some things to help Lily out. And also, I mean, I think Lily is probably wondering what's going on if she doesn't fully understand, and I also think it's important to keep her stress down. So we're trying not to talk about the virus, but it is really challenging not to do that.
Well, thank you so much, Christina, for joining me. I really appreciate it.
Thank you. All right, take care, Becky. Bye.
Stay well. Talk to
That
you
was
soon.
Christina Ingolia speaking with me about how she and her family are coping with self-isolation and how they're keeping her daughter Lily, who has cognitive disabilities, busy. I'm Rebecca Smith, KBIA News, Columbia.